Hi everyone, welcome to Doc Dynasty. I am Dr. Po Raval, a board certified podiatric physician, completely committed to keeping physicians independent and thriving on this channel. So today we're going to talk about whether a business degree matters. So a postdoctoral degree in business, does it matter? I'm just going to give you a little bit of my background. I was 7 years into a private practice, and we were used to billing per code. Health maintenance organizations, HMOs, came in and they started doing what's called bundling codes, something we have even to this day. In other words, they would decide if you were doing this service, you don't get paid for this. If you were doing, in my business, an ingrown nail, you're giving an injection, bundled. So needless to say, it was having a big effect on our financial picture because codes we were individually billing for were now being bundled. It not only was happening in private insurers, but now Medicare was doing it as well. I want you to understand that business matters when you start to see huge paradigm shifts. So that was a big paradigm shift. This is fee-for-service medicine that was now being bundled. It's very important as you go through your professional career to be able to see the big picture of large things changing. And this was one of them. So 7 years into my practice, I started to look around to see if there was a business class that I could take. As luck would have it, President Clinton's healthcare team started a brand new program to bring business into medicine. And it was being done locally. New York University was offering that program, and the heads of departments of all these hospitals were sending their physicians into this program. So I joined the program. It was meant for physicians, so we were able to take classes at night, and I worked it around my practice. As soon as I got out of that program, where I was able to tailor certain classes for what I needed, I got offered a position with New Jersey Medicaid as their chief podiatric consultant. So this allowed me to see what the state and federal government were doing in this category, along with fixing some issues that were going on in medicine. Soon after, the fraud department of New Jersey Medicaid then hired me. So I was running 20 hours with all of this, along with running my private practice. But the experience was invaluable because I was hired for a year and I was there for 7 years to fix all this and to learn. Do I think a degree matters today? So I would not have been offered this position without a degree. It also allowed me to become part of a leadership program. And I think even today, it is not enough to have a medical degree. If you want to be considered to head a hospital system, to head a private equity medical system, or to head a multi-specialty group, I think they are all looking for MBAs past your medical degree, because you have to be able to see larger than where you are. So do I think it matters? I think it does even today, but it matters if you want to pursue leadership positions. Otherwise, I think it's adequate to take classes or SCORE we've talked about, which is Retired Executives, score.com, which teaches individual business classes free of charge. But more importantly, you want to incorporate it. The other way to learn business, if you don't want leadership, is not get the degree, but talk to your software company and see where you can use reports to help you in the business and to structure your business. But as far as leadership and management positions, I absolutely think that that's what they're looking for. And it was game-changing for me. So I do have a postdoctoral master's on top of my medical degree. Hope this is helpful.